So there you are. So this we already spoken about the introduction to healthcare analytics and so on. We said that it's going to give you the fundamental principles, applications, analysis of healthcare data, and many more things. So it is no different from the other analytics or analytical tools that you use either in operations or in hotel industry, but in hospital healthcare, the primary objective is to have the analysis of it. So we are also going to see how to compute the data. So at the reception, you get patients, you fill up those forms, but you feed that form inside the computer databases. That's how you're creating the data. So okay, so one more person must have joined. So let me just go back and admit it. Sabita Reddy has joined. Okay, so we were all discussing the same thing. Yeah. Okay, so this we also spoke. I'm just trying to refresh your memory. Somebody else has again joined. Yes. So right now we have four people. So we have Samudrala Monica and Monica Tandra and then Savita Reddy. All of you are welcome once again. Uh, we did start about different kinds of block. I can revisit that later whenever we have more time. But as of now, I'm just trying to take you through further into the role of computing technologies in healthcare. So, as you can see, we are referring to the innovations in computing technologies, which has always been the case. Tell me any hospital, either the three of you, that you have no computer system except the clinics. I know a clinic near my house. He doesn't use any computers. He just writes it, and but how are they maintaining the data? How do you maintain the data? Will that be applicable in the long run? Will that be okay to have it? What happens if the clinics and the small, hospitals do not use it? I don't think so. If you're running a hospital, if it is more than just a shop, you're supposed to maintain that data. I think they are also maintaining. He has a footfall of more than 100 people every day coming. His clinic is fully, you can say, occupied. Sometimes you have to take the appointment, you have to call up over the phone. So, someone who's managing the appointment, how are they doing it? They are writing the names in the register. So, that data can actually go into the computing part of it, and that is why the information that is collected will also be stored. So let me write it back again for the sake and the clarity of all of you. Give me, so yeah, I'll use the chat box for all of you. So you have uh, the collection of the data. Collection of the data can happen various ways. How do you collect the data? At reception, over the phone or call, then that's one. Then you store it. How do you store it? You're going to store it in your computer memory or on cloud, or you may have a database. That means the software itself can have, uh, but again it boils down to the local drive. So local or you know cloud drive. This is how you're going to store the data. This is very crucial, and the formatting of the data is crucial. So you may collect it, you may store it, but you have to also retrieve it. Retrieval becomes important because if the format is unreadable, if you're not able to know or get, uh, then it is problematic. Has anybody tried Practo, this application, or you have worked in it? Anybody? Are you all there? So Monica, and Sabita, have you tried anytime the Practo? Have you thought of this app called Practo? Any access to that? Or am I talking to myself? Yes, ladies.
Sir, it's used for online consultations if I am
Yes,
not wrong.
certainly. Look at that. The one who has made the app across India, that anywhere, and the doctors are connected through that, then the patients are connected. And you're right, Monica Tandra, that it's an online consultancy. So you don't know anything. Where do you start? You don't even have access to specialized hospitals. And probably that was during the COVID time, and it became very, very, strong. The strongness of that is largely seen during the COVID times. So they are also, taking the data. So you will input your age, you will input your details, male, female, what kind of disease that you're going through, which doctor is going to be consulted. So look at how data is being collected. So you can imagine, you can even have the creativity of it. That's what I was trying to tell you, that it is about the data, and then it goes into the storage part. And what happens if the storage becomes corrupt? So there is always this hard disks. You have a hard disk, external hard disks, and these disks can actually be unreliable. So retrieval of the data is a huge, huge challenge to such things. So safeguard the data for the future purpose or for administrative purpose. Administrative purposes, like someone from the family comes and tells you that I want to know the history of my father, mother, or kith and kin. What were the consequences? Why they were suffering? What has happened to them? And how do I overcome it? And probably the police administration can also come and ask you on what grounds that you are able to take away this thing. This is not the way that you're supposed to do it. And the call records of that person, or the records of that person, will be dug out in plenty. That's why. Okay. So we were largely driven by this thing. And then you are going to provide the tool for solving various problems. And these are problems that can be not just for taking care of the health, but also back of the mind it is the health, but overall if you look at it, it's also the smooth operations. So two important things that you can always think about it. One is the smooth operations. So if I have booked an appointment and gone there, if I have booked an appointment and gone there, so what happens? So the doctor is available between the time to me, between those given times. And so it's easier for the assistant who's trying to manage the appointments. It is also not a burden. You have well in advance information. See, the doctor would like to know that how many patients are waiting for me, how many appointments are there for today. It's so easy. So if there are 10 appointments, he can dedicate time. So 3 hours will be gone for 10 patients. And also the patients will come to know I don't have to go and wait for one full day. I can go because the patients are already suffering, and how can they really be there throughout the day and just sitting there and waiting for the doctor to come. So they can actually go during the same time of their appointment and get it done. And then about the diagnostic and so on, that is the reason it is making the operation smooth and making the patient's patient's life very, very, you know uh, at ease. So patient life will be at ease. That's the beauty of it. That's how you will be able to assist them and so on. The So we also spoke, last time, just to recollect your memories and refresh them, that the challenges and opportunities in the healthcare analytics, it's going to be, you're contributing a lot through the interdisciplinariness of it. That means you have to have, you can, right now you cannot say that I don't want to learn computers and systems and databases and so on. and it is going to create a huge problem if you are not a multidisciplinary person. You may be good in your subject, but you are also supposed to manage it. You are an MBA, but you cannot shy away from the systems, and it's easy. It's very user friendly. One of the other things that I was trying to tell you since last two classes was the user friendly uh, attitude of the yeah the user friendly attitude that you have uh, of the databases. So it's no more a tough thing, and it's easy. Like, how do you use cell phone? Do you find it really tough, difficult? And you said, no, 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 it's so tough that we cannot really know about it. You learn it. Who has taught you how to use a cell phone? I think none. You learned on your own. The whole navigation that you have is on your own. So you should have hands-on experience. Hands-on experience with the databases can go a long way. That is the motto, that is the most important part of it. Okay, that's why you have it. Now, moving on, if you look at it, then the computer scientists are not trained in domain specific medical concepts, and medical practitioners and researchers have limited exposure. And this is a huge gap. I'll explain you in detail. Like, why should a doctor who has spent, why should a doctor learn computers or computing technologies? Why? Why do you think he or she should learn? Whose job is to learn? Yes, ladies, tell me. Hello, are you all there, or you just put your phones and then you are you're merely there at will?
Yes, sir.
Yes, sir.
Yeah, why should a doctor learn the computing technology? What do you
To
think,
protect
Monica?
the to protect with all the information of the patients.
Yeah, but he
Every
can assign.
To
He
store
can.
patient data, sir.
Okay, that's true, but it can be done by his PA, or it can be done by the, some other person or the office assistant. But why does a doctor need to learn it? What is the fun of it?
it is a minimum discipline of a medical in storing of data, sir, by doctor as a hospital
Mm-hmm. Okay, sounds interesting.
uh, to protect all the matter by the medical management.
Okay, all right. Okay,
It is a special. It is a special interest that healthcare organizations must provide
yeah,
secure data by the medical.
yeah. So now that there are some regulations as well, there are some mandatory aspects of how you are able to manage data. Hence, it is of great importance to all of them to look after it. That is the reason that even the doctors are not spared. You may be super specialized, you may be the best cardiologist, but at the same time, you should have, and it is learnable and it is easy. Hence, that is the reason we are concerned about it. Okay, there
Okay,
you
sir.
are. So, in both the cases, they are complementary. They are assisting, they are helping each other. So, on one hand, I am a doctor and I don't know anything about the latest computer technologies, and I will learn it from the technocrats. And in turn, the technocrats have no idea about medical science. They don't know the terminology. They don't even know the specifications. Like what should be the minimum BP, the maximum BP, what should be the diabetes or glucose or those aspects. These are only be told, retold, dictated, instructed by the doctors. Hence, they are complementary. They are feeding each other, and that's how the growth of any discipline will go further. Healthcare analytics is the outcome of both healthcare professionals and the technocrats. They have teamed up together, they have joined hands together, and they are trying to help overcome many of the challenges that you have. So it is, in a way, that it's largely dominated by the computer technologies. So which one is crucial is very difficult to say. Uh, is it the analytics part which is crucial, or is it the health part which is crucial? So purpose wise, if you see it, it's the health. But administrative side, if you look at it, it is the computing technologies. So I'm writing again in the chat box just to reiterate, or if you're following, and then these pop-up messages would appear before you, and you will be able to easily make out, what are the differences that you have. So from the health point of view, yes, it's very crucial, and from the administrative side of it, because nowhere that you can actually present and preserve the data better than the computing technologies. So, the handling the data, storing the data, retrieval of the data becomes of primary importance in all the cases that you have. So, that is why it is of very, very important and crucial stage that we are in. Okay, there we are. Let's move on. So, what are the analytical techniques for healthcare problems? So, it will surely going to contribute from different industry. It's not just academic interest. I think it's more of a practical interest. When I say practical interest, so the healthcare data analytics will surely going to involve the identification of the data. So much of the data is of no use to you. What are you going to use is the question, and you should be able to have the basics of the data analytical techniques. Like if you want to find out the average income of the patients who have come to you, or if you wanted to know what is the maximum number of patients who got the same disease, how many KIMS is witnessing a huge rush during which are the diseases that you usually get in summers? Seasonal diseases also, the hospitals are flooded. So, which are the diseases that you usually have in summers? Seasonal diseases. Anybody?
Sir, heat stroke.
Heat stroke, right? So because the seasons are really harsh, and this season is going to affect and impact you, so the heat stroke, you will have a sunstroke or heat stroke. These are the problems that you will have. So what kind of things that you are in a position to make arrangements for such things? Now there is a yellow alert being issued by the IMD department. The state government is also trying to help people and issuing orders and communicating through the mass media, allowing people that they stay indoors, not to go outside unless until otherwise. So heat stroke. So but are a hospital equipped for it? So, what are the chances that heat stroke can lead to fatalities, can lead to some kind of, you know, life-threatening thing? Is it a life-threatening? In cases, yes, it can also be life-threatening. Like in winters and rainy seasons, you have a lot of vector-borne diseases. So because of the pollution, because of the contamination of the water and the new early water bodies, the ponds and lakes and the water that is being supplied by the municipality, they may have diseases. So vector-borne diseases are the ones that you will generally have it. So through that, you will be able to solve it. So suddenly you have COVID patients. So in the COVID patient, all other things, what is the important part in an epidemic or pandemic? In pandemic, all other diseases will not be dealt with more, care, except the pandemic patients. The priority is given to the population because they are vulnerable. So if you have fever, if you have a headache, and if you have other issues, that will take the back seat. You will be put into the back burner of it. But you will always be checked onto the pandemic or the epidemic diseases. So you should have that analytical tools and analytical techniques to solve the healthcare problems. And you should be quick enough to solve it. You should be able to reduce the numbers. Do you remember that there was a COVID bulletin every day released by the, I think, the uh, National Medical Council every day? So why were they releasing it? Even the state government used to release it. Which were the states that were dominating the COVID numbers? Any idea during that time? Okay, so let me take you through there. All right, so let's search, and I wanted to take you this site. Okay, uh, so I'm doing it Google search just to make you COVID data in India. Okay, I'm doing a simple Google search. So this is from the Ministry of Health and Family Welfare. Please do visit this website. We will do some practicals as well. So I'm putting this in the chat box as well. So the site is already there. Look at this one. Can anybody tell me what is the overall idea? What do you gain from this? Can anybody tell me what is there in this? There are three different colors: blue, green, and red. Blue represent the active number of cases. The percentage is almost negligible or coming to zero. And whereas the patients that are discharged are 98.81 and the deaths reported are this one. What do you infer from it? And look at the vaccination data also. So can you click onto this link? Anybody? Everybody? Hello? I want you to click on this and check the state data. Look at the state data. Can you see this?
Yes, sir. You can see the screen, sir.
Yes, you can see. And now I want you to open this in your cell phones or laptops, whichever that you're using. Go to this website and open and tell me what do you infer from this data. The link is also provided in the chat box. Please click that link, www.mohfw.gov, and then navigate through there to here. Okay, I click that link and I come here and I ask you to get to the state data. Now tell me from the state data which state has actually got uh, more number of deaths. Tell me. And then this is the latest data. This is, you can see the time as well. This is just in the morning that they have created. This is less than 24 hours. It's not even 12-hour old data. Are you following me? Tell me. So there are 36 total states and union territories. So 28 plus 8. Tell me. Tell me which state has the highest deaths. Can you browse through and tell me? Who's generating that? Yes, please. Are you able to see that on the screen? Anything further? Hello, Monica and others?
Yes, sir.
Yeah. Are you able to do it on your own? Just feel free. Just browse through. Tell me if this is given to you, this chart is given to you. Now, tell me which state is doing good in terms of discharge. Any any quick thoughts on that? This is a very macro data, no? Which state is doing good in terms of discharges or has done good in terms of discharges? Looking at it, tell me. How about Andhra Pradesh? Or how about Kerala? How about Maharashtra? Look at that. The numbers are going quite big, isn't it? So overall, the data is able to tell you. So there are a lot of things. Look at the beauty of the data analytics. It's so easy to do it. So they are also given this links and it becomes easier for you to browse it. You can go to the sources and then look at the hospitals. Look at the hospitals. Or go to the training part of it, operational guidelines, and so on. Genomic sequencing, anything that you find it very, very different in overall, or the awareness material. Look at this one. What kind of, how to use, oximeters. They're all given. Or the booklet for frontline workers. These are there. Look at the series of things that are there. Doctors Away, musical tribute, healthcare service professionals. Wow, this looks quite good. Break the stigma, do's and don'ts. India is actually a stigma driven society, and it's not easy for them to do it. You got it? So you can go back and then look at the other parts of it. What else can be done? You can always come back and check into it. You can probably check those details. Check the resources as well. So quite a very simple, database and reliable database, and you can even get it through, at one click itself. So in one page itself, it gives you the whole idea about it. So you want to have the vaccination data, then there is this thing. So it leads you to the look at this one. You can download this, and I want you to download it also, and we'll do a study based on this. I am just presenting you. Just a minute. Where is that thing? Yeah, I'm here. Okay. You can download this one-page sheet, and that's how it looks like. Uh, yeah, this is the cumulative thing. How do you get this into? This is in PDF. How do you convert it into Excel? What is the way out? Anybody? How do you convert this into Excel? Because with this is still okay, but the same can be done through the Excel much easier. So there are apps to convert it. So kindly use. I want you to, convert and show me how to convert it. Can you try this? Converting this into Excel. Will all the three and four of you try it? Are you all with me? Hello. Yes. So this is the one PDF. Please convert this data into Excel so that you can do a lot of analytics and use techniques for analytics. Okay, is that fine with you, all of you? Okay, let's move on. Let's go back to the main thing that we were discussing. All right. Yes, we were here somewhere. Yes, that's how it is. So you can use this application of the healthcare in so many different ways in analytical tools and improve the health and well-being of the people. So two things that we were talking precisely. One is the health itself. The other one is well-being. Well-being is always proactive. Before the disease comes, prevention is better than cure. I should be feeling good. Whereas health, it's to restore it. Then the whole aim of us is to get into the well-being part of it. That's why it is important. So this is the healthcare databases, and you can easily go. And I also wanted you to take you to, because let me just take you to another thing that I wanted to talk about is WHO. Could you just click this website and find out from India what is it? Okay. Can you see this website? I'm posting it. Country wise. I want you to click that and go to data by country. India is here. How's WHO able to maintain this data? How are they generating the data? Any idea? Now tell me about the life expectancy. What is the life expectancy in India? Looking at this data.
It is the morbidity and mortality, sir.
Yeah. So which country has good life expectancy? Can you find out from the WHO website? Or you can check this. Look at this graph that says a lot about it. So have we improved or have we not improved? In 2000 we were 62.1. Now in 2010 we have certainly improved, and now that in 2019, so this is 70 years. So the life expectancy at birth could expect to live is in the 20 years, people can survive till 70 years. And it has actually improved by almost 9 years,
Yes, sir.
which is really great. And worldwide also they have given. What is the worldwide average? If you look at it, worldwide is 73.3 years, and India is closer to it. The worldwide life expectancy is better. In fact, we have improved more than the world. It's 8.68, whereas we have improved 6.52. The
Five
world.
two.
Yeah, look at that.
Yes.
The same thing. What are the chief leading causes of death? If you look at it, if you do not know the causes for, and this is a very wonderful site, and I want everybody to visit once in a while. And what is this? Ischemic heart diseases. One of the biggest killer for both men and women in India is heart
Yes, sir.
disease.
Ischemic heart disease.
Yes, look at that. It's
Yes, sir.
huge in both the males and females. In fact, there are more males who are dying because of heart diseases. Heart diseases is not that rampant among the females, although this is the biggest cause. And the second biggest killer for females is the diarrheal diseases, where you're going to lose the must most of the vital nutrients and vitamins. That's one. Look at that. Whereas here for males, it is again
COPD.
two. Yeah. So chronic obstructive pulmonary disease. Oh, look at that. And then females also suffer. They are very close to it. Then the stroke. Males have a lot of strokes. In fact, males and females are close. So death you know per lakh, you will have at least 52 people dying because of the stroke. Males are
Sir,
dying.
male female segregation is not given, no, sir, here.
It's there on the top. It's here. Look at this. Top causes. Can you see this? I'm highlighting it. Can you see my cursor?
Sir,
Segregation is
oh,
there on the top.
yeah. Top causes death of males, sir.
Yeah, for males and for females. Now, as a medical professional, if you have got, that's why most of the corporate hospitals are just trying to give you a good understanding of the heart diseases, be it Yashoda Hospital, be it KIMS. So the kind of facilities that they are creating, because more people are dying because of the heart disease. That's the biggest killer. And for female, I think at the rural level, the hygiene. So the sanitary hygiene is important for the diarrheal diseases, whereas men really don't suffer with that diarrheal diseases. So there are few common things, but except this diarrheal thing, do we have diarrheal disease is there, but far more difference. Almost half of the males and females, if you look at it. So how males suffer versus the females suffer is a great analogy that you can draw. Look at this one versus this one. It's 37 only. Neonatal conditions, I think more or less it's same, 31.5 versus 31, right? And lower respiratory infections, females do suffer slightly more than them. Cirrhosis of the liver, which is not there in the females, which is only related to males. Look at this one. Tuberculosis. Tuberculosis is high in both. So males have more than females. Look at this is interesting. Diabetes. So diabetes, although we are diabetes mellitus, type 2 diabetes, which we have more in number. So female and males have it, but females and males are closer to it. So there is equality at least in diabetes as far as I see it. And who are the people who die more in the road injury? Who are the ones?
Males only.
Males. Look at that. Yeah, you don't even have that condition in females, because females are not many drivers. No, females are not driving. There are very few.
Females are also driving, sir, but females are, will drive more carefully than males.
Yes, yes. Even the population is less for female drivers, but they also drive with lot of responsibility and with carefulness. You're right. And look at this falls. What are falls? Second floor, third floor, fifth floor, washing or putting your clothes. Those are not done by males. These falls are largely by females. This is also missing in the males. And then asthma. Asthma has another big cause or worry for the females as well. See, this is a wonderful, database, and also authentic, reliable. So when we say reliability, we are referring to that. I can again come back to it. Just let me type. So this is more reliable database. And the other is, it is largely giving you macro data. That is why it's important to look at it. And also visualization. See, it's not just merely numbers, the bars also. Visuals are good. Visual presentation of the data. It's quite really, really better. Right? Okay, so let's quickly move on and then we'll try and wrap up. Look at this one. So these are the archives. I want you to download this one. So this is the last time that it was downloaded, or the data is available till 2020, December 9th. What does this has? Number of deaths by age, cause, sex, and country. It's a very small file and I can download for you. And then here, the death rate by cause, age, sex, global health estimate. Okay. This gives you the summary of the data and you can get that. And this is also the population data. We should be able to do that. Look at this one. How do you see this? In fact, I want you to open in your own laptops or phones to check on this. Each one of them. Males and females. So when you say population of India, 1.4 billion, who are the people who are at this age group? Bulk of them. Tell me which one of them have the highest number of group? Which one? How many millions? Which is the bulk of the population? Huge one. Look at that. That's really good. Okay, I'm going down. And the completeness of birth and death registration. How many people are the percentage of birth registered? This is little old data, 10-year-old data. It's only 80% of them. Why people don't register for the birth? Because many of the births are happening at homes. May not be in the hospital. But they may not even go to the municipality to get their birth certificates. So it also gives you a lot of indicators. This is the civil registration statistics that gives you. What are the different metadata? What is metadata? You heard of this word called metadata? Anybody? What is meta? Metadata. Anybody heard of metadata? It is nothing but data of the data. So WHO is using data of the data. So for India, it is the data, but for WHO, it is the India data plus the world data plus the other countries' data. All those things. Let's move on and see how other things are. Are you able to find it interesting more than the lecture?
Yes, sir.
Yeah, I mean, you should be able to visit it. I want you to download that file. Let's download it and check into it. This looks. Let's download it. Oops, doesn't allow. Why it doesn't allow? Okay, it may have blocked the access, but I think we should be able to download it. Try it a few more times and you'll get it. That's otherwise we'll try and do it. Okay. These are the shortcuts, short names, all that region wise, security wise, domestic GDP data. This is brilliant. How much India is spending on the GDP of what is the overall expenditure of India's GDP? I told you about visualization. Come to visualization and look at for it. Country profiles and then click that. You will see the dashboard. You'll be able to get that. It's still reading and gives you that. Loading the data. So these are the ones. Look at that. Health spending. Have we really spent more or less from 2005 to 2021? What is your take? Are you able to see this? Check that. So current health expenditure, and this is done by the Microsoft Power BI. That's the software. So overall, you can see it. And look at this one, the sources of health expenditure. Government spending is less. Out of pocket spending. Can you tell me what is out of pocket spending? Hello?
It's like insurances, sir.
Yeah, you are paying from your own pocket. So huge one.
Some government schemes will be there.
But very less, no? Look at the data says the government transfer is less. The government is spending not much. Where are the blue parts of it? The blue
Very
part
less.
is, yeah, in fact, during the COVID times, all the government didn't spend much. The expenditure was less. It was just 7%. Whereas the 75% of the diseases, if you get a disease, what do? You have to spend on your own pocket. Even though you
Yes,
are
sir.
saying it's insurance, but you're paying the premium, no?
Yes, yes.
Who's paying the premium? So all the claims that the government says that we have 5 lakh insurance and so on doesn't hold true here. It is quite ironical. And this is from a reliable database. And look at the external aid. External aid is more. It is more than the government. Social health insurance is also quite low, very less. So these graphics are quite, scary and frightening at the same time. But you get it. So you can always. This is about Afghanistan, and select the country. You will get it. Okay, let's go to our own beloved country and then check how does it work. Oops, it's the drag and drop thing. Hmm. There we are. Oops. It doesn't allow me to. It's to select is an important part of it. There, there we go. This is the one. Now tell me, What do you see? Any idea? Any comment? So the government did spend in the last few years, but not much. People are paying from the pocket. That is the case with Afghanistan and India as well. Okay, this is how you can actually go and check. So there are a lot of, like, we can even go there, check onto this different things, and come back. Okay,